Welcome to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and the latest medical insights. Joining us today on this episode is Dr. McCall Walker, an interventional cardiologist at Cardiovascular Institute of the South and Terrebonne General Health System. Welcome to the show, Dr. Walker.
Thanks for having me. I really appreciate it.
All right, well, today we are going to reveal some secrets to heart health. Everybody needs to know these things.
That's right.
And before we do that, let's get started with you telling us a little bit more about yourself and your role.
So my name's McCall Walker. Thank you for the introduction. I actually grew up around these areas. So in Berg, Louisiana, I come from a family of several doctors, actually. My dad was a general practice doctor. My uncle is Craig Walker, who started CIS. My older sister is a radiologist at Terrebonne General. And so I was exposed to a lot of medicine from a young age. And that was something that I really enjoyed from a young age. I ended up doing my training at several different places outside of Louisiana. And then about 2 years ago now, came back and joined CIS. My first year back, I worked with Dr. Craig Walker specifically as his peripheral interventional fellow, which means I was doing leg procedures with him in both the arteries and the veins of the legs. And in August of 2024, I started on my own, still as part of CIS, but now with my own clinics. And I've been enjoying the first 6 months or so of that, and here I am today.
Well, I know you have a couple of fellowships also, correct?
Correct.
Is this the third one that you're working on now?
So my fellowships are done at this point. I did general cardiology, which was 3 years at UT Southwestern in Dallas, Texas. I stayed there for an additional 1 year of interventional cardiology. And then the year of 2023 is when I came back and did the peripheral year with Dr. Walker.
Okay, well, you have a vast wealth of knowledge in these things for sure. And I guess you had no other choice but to go into medicine, right?
That's right. I actually thought about a few other things very truthfully throughout the end of high school and throughout college, but medicine really clicked with me, whether that's because I was exposed to it from such a young age, or if it was something that I just enjoyed more. I can tell you that my last few years of college, I was a biology major for that. I was pretty focused on, I'm going to go to med school. I'm going to, continue what a lot of people in my family have done. And I really enjoyed the whole process.
So interventional cardiology is your specialty.
Interventional cardiology, specifically about 50% of my practice right now is heart related. And the other 50% is peripheral or leg related, so involving the arteries and veins outside of the heart.
Why should Americans be concerned about cardiovascular health?
Great question. Very important, especially during Heart Month. So there's a few very important points here. Number one is that cardiovascular disease is the number one killer in America right now. So that is more than any cancer. And in fact, that is more than all cancers combined. Not to say that those things are not important. Of course they are. But the number one killer in America is cardiovascular disease.
And is it a silent killer?
It can be a silent killer. So just to kind of give a little bit more on the impact of cardiovascular disease, about 1 American dies every 36 seconds from a cardiovascular problem, which almost seems like an impossible number,
right.
But that's what the statistics show. What you mentioned about being a silent killer, yes. So as we both know, a lot of people will be doing fine one day and the next they end up in the hospital with either a heart attack or a stroke. That's clearly something that has been brewing for months to years, but it happens all of a sudden. And the whole time that is building up, you may not have symptoms. Some people are fortunate enough to where they do have a slow progression of symptoms such as chest pain, heavy breathing, things like that. But some people, it can happen all of a sudden.
Why do you think these statistics are so high?
I think there's a couple reasons for that. So number one, and this is the good part of it, is that we've gotten so good at treating other diseases such as cancer, such as things like diabetes, hypertension, that less and less people are dying from those in particular. However, it is much more difficult to control a lot of the risk factors that lead to cardiovascular disease, and especially in places in South Louisiana where we absolutely love our food. There's no question about that.
Right.
Some of those things that we love can sometimes be the things that hurt us.
So cardiovascular disease goes beyond just the heart. Can you tell us more about that?
Absolutely. So if we focus just even outside of what most people think of in the heart as heart disease, which would be a heart attack, different pieces of the heart can have their own problems. For instance, you can have valvular disease. Everybody's heart has 4 valves in it. Each or any of those valves can cause significant problems, just as important as coronary disease, which is blockage. Outside of that, you can have problems with the lining of the heart. We've seen, especially in the post-COVID era, we've seen that some people can have inflammation of either the lining or of the heart muscle itself related to not only COVID, but other viral illnesses. And outside of the heart itself, as I mentioned, I treat vascular disease also, which is the arteries and veins. And problems with those can be connected to the heart and also can have independent problems for people.
So who should see a cardiologist and when do they need to go see a cardiologist?
Great question. So certainly anyone who is having concerning symptoms. And what would those symptoms be? So that would be something like chest pain, chest pressure, or chest tightness. You can have symptoms that can go down into the arm. So if that pain in your chest is radiating down the arm, certainly into the left neck or the jaw, those types of symptoms need to be evaluated immediately. People who don't have symptoms but do have risk factors, and that can be things like hypertension, which is high blood pressure, diabetes, which is high blood sugar, high cholesterol levels, or even things like a family history of heart disease can be very important. And I would argue that those people definitely should be evaluated by a cardiologist as well.
I was reading something saying that even if you don't maybe have symptoms or anything, you should establish a relationship with a cardiologist at a fairly young, I think it was 45. And I was like, 45, that sounds really young. But why is that a good thing to do?
Yeah, great question. So there are a couple populations of people that really stick out in my mind that should be evaluated earlier, even without some of the symptoms I just mentioned. So certainly a very strong family history of heart disease, and that would be anyone who has a first-degree relative, so a mom, dad, brother, sister, who had heart disease in women before age 55 or in men before age 65. Those people are really at an increased risk of heart disease. And if there are certainly multiple people in your family who have had something like that happen, again, heart attack, stroke at a young age, you should be evaluated. Another group that kind of flies under the radar sometimes is people who have congenital heart abnormalities, meaning they were born with a heart abnormality. The biggest one that comes up that we see is people who were born with an abnormality on one of their valves. If that is something that's been diagnosed in your family, depending on what valve it is, a lot of those people would benefit from a screening at an earlier age to detect if they also have that same abnormality.
How many people are affected by that?
So that is a more rare disease. The one I'm talking about is called a bicuspid aortic valve. And that is something that is really only one in every several thousand people. But outside of that, again, people who have family members with early heart attacks, early strokes, sudden cardiac or unexplained death, somebody who was fairly young and one day they just died and you don't have a good reason why. All of those people should be evaluated.
So a lot of people don't make good lifestyle choices that can lead to bad hearts.
Right.
So what are some things or secrets that you can share with us about how to prevent cardiovascular disease?
Yeah, good question. So as I mentioned previously, going back to the risk factors is what the important thing is here. And the most important risk factors are blood pressure, blood sugar, as well as things like family history, degree of physical activity or inactivity, and weight. And so the two of those that you can really focus on the most are your level of physical activity and weight. So from a physical activity standpoint, the ACC, which is the American College of Cardiology, and the AHA, the American Heart Association, recommend that to be heart healthy, you really should undertake at least 150 minutes per week of moderate intensity exercise. They do say that if you do high intensity exercise, you can cut that in half. You can do 75 minutes per week, and that's spread out over 5 days. So they kind of let you take the weekend off, if that makes sense. And what is moderate intensity exercise? A perfect example of that is walking to the point of where you could talk to somebody standing next to you, but it would be difficult to talk in complete sentences. So your heart rate's up, you're able to still talk, but hard to have a full conversation. That's a good example of moderate intensity exercise.
That doesn't sound like it's too hard to do, but a lot of people have a hard time.
Look, I would agree with that. And what I would say is that, yes, the recommendation is, 150 minutes spread out over 5 days, which is roughly, 20 to 30 minutes, 5 days a week. However, you don't have to start there, right? You can start with something as simple as 5 to 10 minutes and work your way up to that. I don't expect anybody who sees me who's very physically inactive to jump straight to that 20 to 30 minutes a day.
Right.
So even if you start out a little bit slower and work your way up to that, you're going to do yourself good.
Right. And I guess diet plays a huge factor. Actually, a friend of mine just went to a cardiologist and they told her to lose 20 pounds. But they did give her some tools to help her, to make that diet adjustment.
Absolutely. Diet is certainly the other side of that coin, really, to physical activity. A few things to keep in mind from a diet standpoint, going back to those guidelines by the ACC or the AHA, which is kind of our governing body for cardiology. Avoidance of high intake of red meat. So I love steaks. I love hamburgers. There's no question there. No one's saying you can't eat those, but you should be very mindful about how much you're taking in. In a week's period of time, somewhere, and this sounds like a low number, I know, but somewhere around 2 to 4 meals, not days, but meals of red meat is probably the number you're looking for. So, save that ribeye or that, exactly, or that hamburger, that cheeseburger for your treat maybe at the end of the week.
Yeah.
The other big important thing that is really in the media a lot now is oils. What oils do we need to look at? What oil should we focus on? A lot of people cook food in oil, right? We use either margarine, butter, oil. What should you be using? The most evidence is for extra virgin olive oil. That is something that has not only been shown to be least harmful, but also has a cardiovascular benefit to it. Other liquid vegetable oils are also okay. Probably the second best would be avocado oil, but if you can try and focus on those and away from certainly solid oils or lards, fats, things like that, then you can also do yourself a big favor.
Yeah, well, those are some good secrets right there. Well, let's talk more about you and your passion for cardiology. Tell us a little bit more about what your specialty is and your passion.
Absolutely. So I'm an interventional cardiologist. I also do function as a general cardiologist. So I will see patients of all walks from a cardiovascular standpoint. My subspecialty, interventional cardiology, and from that also peripheral cardiology, is specifically working on people who have either blockages in the heart or blockages in the arteries of their legs, or potentially even more recently, what I've expanded to is vein problems as well, which is a part of cardiovascular disease that very commonly goes unknown to a lot of people.
Well, thank you so much for being with us today.
For sure. Thank you for having me. It's been great.
Heart Month is a great time to get a checkup. Visit cardio.com to schedule your appointment. Thanks for joining us on the podcast today. Don't forget to share, like, and subscribe to our podcast where you get your podcasts. Thanks for listening.